So neuroendocrine tumors are a group of tumors in our body that consist of specific cells which are called neuroendocrine cells. Those cells can be found forming glands such as pituitary, adrenals, parathyroids, but also can be diffusely distributed in many organs, and most commonly the gut, the stomach, the pancreas, and this is where we can find the majority of those tumors. Those tumors have got 5 main characteristics. First, they are heterogeneous, which means that they consist of different cells that play different roles. Second, they are usually slow growing. Third, they usually secrete hormones and therefore can cause specific symptoms. Fourth, they may have receptors of somatostatin, which is a specific hormone on the surface. And finally, those tumors luckily can be treated with more than one option. In the past, those tumors were considered to be rare, but it's not the case anymore because recent studies have demonstrated that over the last 30 years, the incidence of those tumors has substantially increased, whereas the incidence of all other cancers has remained stable. Those tumors can become more or less aggressive, and I can borrow the example of an old-fashioned Western, the good, the bad, and the ugly, to divide them into slow-growing tumors, which some of them may never spread, and this is the good group. The bad group are tumors which are still slow-growing, but at some point they will spread, and the ugly group are the tumors that behave really aggressively and they look like other cancers. The diagnosis of those tumors is based on a good history and examination by the physician, also on blood tests and urine tests, third, on good quality imaging studies, and finally, on biopsy. Symptoms of neuroendocrine tumors can be variable. Patients can present with chronic diarrhea, which means diarrhea for more than 4 weeks, flushing, which means that their face becomes red for a few minutes. Then patients can have chronic cramping pain. Patients can have ulcers in the stomach or duodenum difficult to treat. Patients can present with episodes of low blood sugar, but also patients may have no symptoms. And in those cases, neuroendocrine tumors can be revealed just incidentally. The physician, when he's trying to make a diagnosis of neuroendocrine tumor, should follow the steps of a history clinical examination, but also use high-quality imaging studies, such as the gallium-68 PET scan, which is the most modern imaging modality that someone can use for neuroendocrine tumors, and it's a whole body scan and can pick up tumors as small as 7 mm. Through that scan, tumors cannot be missed, but the tumors can be missed only if the physician does not suspect them. When we are treating a patient with a neuroendocrine tumor, we are following the 4 principles. First of all, we are aiming to control patient symptoms, and especially those who are related to the hormonal secretion by the tumor. As soon as we achieve this, we discuss the patient case with our surgical colleagues to see whether they can resect the primary tumor or even the metastasis. If this is not possible, then we try to find ways to delay the tumor growth and even shrink the tumor. And last but not least is we as physicians try to improve and always maintain the patient quality of life. For the first target, control of patient symptoms, we are lucky to have easy medications, which are monthly hormonal injections, which can be given easily by the patient GP and some of them even by the patient themselves. So those injections can control the hormonal symptoms of the tumor but also can delay the tumor growth. If this is not possible, the physician who treats neuroendocrine tumors is lucky because he or she can choose from a variety of options, which can include the injections that I mentioned, chemotherapy, oral tablets that are inhibiting the ability of the tumor to produce vessels, but also many treatments including radiation treatment, internal and external.